In order to prevent cross-contamination of infectious organisms, the first line of defense for every healthcare provider is to ensure that your hands are as clean as possible. It is a crucial yet simple disease prevention measure by reducing the number of pathogens on your hands. Yet we didn't always have such a clear understanding of how pathogens spread. Let's consider the tragic story of Mary Mallon, an Irish immigrant cook who infamously became known as Typhoid Mary. Through her story, we have a better understanding of cross-contamination and the importance of hand hygiene. For the summer of 1906, New York banker Charles Henry Warren and his family rented a luxurious home in Oyster Bay, Long Island. With them, they brought servants and a cook named Mary Mallon. It wasn't long before one of Warren's daughters became ill with typhoid fever. This upscale seaside resort was not the sort of area that one would expect to see typhoid, which was often associated with crowded poor neighborhoods. But soon Mrs. Warren, another daughter, 2 maids, and the gardener also had the disease. The Warrens and their staff were lucky and recovered, but after the summer ended, the family who owned the home were afraid that if they didn't get to the bottom of what had happened, they would never be able to rent their house again. So they hired Dr. George Soper, who was known for his ability to track down the source of a disease. After a thorough investigation, Soper discovered that in the 10 years that Ms. Mallon had been cooking for a total of 8 families, 6 of them had suffered typhoid outbreaks. This couldn't be just a coincidence. Soper knew that typhoid was spread by unclean hands, usually infected while in the bathroom. But how could Ms. Mallon spread disease without ever appearing sick? If his suspicions were correct, Miss Mallon would be the first American ever identified as a healthy carrier of typhoid fever. He needed to find and question her, as well as obtain blood, urine, and stool samples to test for typhoid. In 1907, Soper found her working again as a cook in the home of Walter Bowen. His only daughter and their chambermaid were already critically ill. Soper approached Mary while in the kitchen, and he tried to explain to her that he was sure she was the unwitting cause of the typhoid fever outbreak at Oyster Bay the previous summer. Mallon became angry at the accusation and chased Soper out at the point of her meat fork. Weeks later, he approached her again at her tenement home, this time with the backup of his assistant. Another request for specimens set off her violent temper, and she angrily threw him out of the building, unable to understand why this man was harassing her. Realizing it was going to take more persuasive methods to change Mary's mind, Soper approached Herman Biggs, the director of the newly formed New York City Health Department. Upon hearing of the death of the Bowen child, Biggs agreed with Soper's suspicions, so he sent Dr. Sarah Josephine Baker, a health department inspector, to talk to Mallon and obtain the needed samples. Mallon, now extremely suspicious of these health officials, refused to cooperate with Baker. Baker returned several days later with 5 police officers and an ambulance. As police surrounded the house, Dr. Baker approached Mary, requesting her to come in for testing. Mary brandished a fork again and ran. After 5 hours of searching, police found her hiding under the stairwell. She was taken, kicking and screaming, in the ambulance to the Willard Parker Hospital in New York, with Dr. Baker sitting on top of her for restraint. Once there, samples were taken, and it was determined that she was as dangerous as Dr. Soper had suspected. The health department then transferred Mallon to Riverside Hospital on North Brother Island in the East River. It was the city's largest quarantine facility where patients with all sorts of infectious diseases went to either recover or die. Mary Mallon believed she was being unfairly persecuted. In 1909, after having been isolated for 2 years, Mallon sued the health department. It went to trial, but the judge ruled in favor of the health department, and Mallon, now popularly known as Typhoid Mary, was sent back to the isolation cottage on North Brother Island with little hope of ever being released. In 1910, New York hired a new health director, Ernst Lederle, who decided that Mallon should go free as long as she agreed never to work as a cook again. Anxious to regain her freedom, Mallon accepted the conditions, so Mary was released and required to check in regularly for testing and updates. Unable to work as a cook, Mallon took a job as a laundress. It was horrendous work, paid close to nothing, and Mary was barely making a living. Growing increasingly resentful and feeling perfectly healthy, she still did not believe that she could spread typhoid. She eventually eluded the health department, changed her name, and went back to work as a cook. In 1915, nearly 5 years after Mallon's release, the prestigious Sloan Maternity Hospital in Manhattan contacted George Soper because they were suffering from a typhoid outbreak. 25 doctors, nurses, and staff members came down with the disease. 2 of them died. Soon, evidence pointed to a recently hired cook, Mrs. Brown. Soper went up to the hospital kitchen, and sure enough, there was Mary Mallon cooking for the hospital staff. She again was sent to the North Brother Island to live in the same isolated cottage that she had inhabited during her last confinement, this time with little sympathy or understanding from anyone. For 23 more years, Mary remained imprisoned on the island. The exact life she led is unclear, but it is known that she acclimated, made friends, and helped around the hospital. After suffering from a debilitating stroke, she died in 1938 at the age of 69. In all, Mary Mallon infected 49 people, 3 of whom died over the course of her career as a cook. She was forcibly isolated twice by public health authorities and died after a total of nearly 3 decades in isolation. She never accepted that she was the cause of any typhoid outbreaks. Much was learned about the spread of disease and the state of healthy carriers during Mary Mallon's lifetime. Sweeping changes in public sanitation and personal hygiene dramatically reduced the spread of typhoid, smallpox, diphtheria, and tuberculosis. Today present similar challenges, just different diseases such as HIV and hepatitis. The lessons that were learned during Mary's time still ring true today of maintaining a clean environment and practicing hand hygiene. Hand washing doesn't take much time or effort, especially with today's alcohol-based hand sanitizers. But it offers great rewards in terms of preventing the spread of illness. Adopting this simple habit can play a major role in protecting your health as well as your patients.